Hold on. Dr. Divya?
Sir?
Oh, yes, you can. Yeah,
Yes,
okay,
sir.
you are there. You are there. Okay, yeah.
Yes.
So, good evening, dear participants. Welcome to the 19th day of the certificate course in counseling skills. I invite Ms. Shakti Priya to introduce Dr. Divya. Welcome, Shakti Priya.
Thank you, sir. Coming together is a beginning, staying together is a process, and working together is success by Henry Ford. Good evening to everyone present here. I'm delighted to welcome you all to this session when the pursuit of knowledge is driven, where the pursuit of knowledge is driven by the curiosity and enriched by the expertise, fostering growth and meaningful discussion. It's my privilege to extend a warm welcome to all of you to this session. On behalf of the Department of Counseling Psychology, I would like to extend my sincere greetings to our esteemed head of the department, Dr. A. John Balaya, respected professors, and all the participants who have joined us today. Your presence reflects the keen interest and commitment towards academic learning and professional growth. We are truly honored to have with us Dr. Iniga Maria Divya B., MD Psychiatry, a distinguished academician and clinician in the field of psychiatry. She completed her MBBS from PSG Institute of Medical Science and Research, Coimbatore, followed by an MD in Psychiatry at Trichy SRM Medical College, Hospital and Research Center, Trichy. Currently, she serves as an assistant professor at St. Peter's Medical College, Huzur, while also practicing as consultation psychiatrist in Krishnagiri with extensive experience in both the field of education and clinical practice. Ma'am has contributed significantly to the field of mental health. It's a great privilege to have her with us today, and we look forward to gaining valuable insights from her expertise. I encourage all the participants to make the most of this opportunity by engaging in discussions and actively participating in the session. I once again extend a heartfelt welcome to Dr. Iniga Maria Divya and all the attendees. Let us look forward to an enriching and productive session. Thank you.
Welcome. Thank you. I request all the participants to come on the videos for some screenshots with today's resource person, Dr. Divya. Participants, please, come on the videos and keep smiling for at least 30 seconds. Mr. Mohan?
Yes, sir. Yes, sir. I'm ready.
Yes, yeah, okay. So we are all on smiles, yeah. We are with Dr. Divya. Participants, all of you requested to come on the videos for 30 seconds. It's a great moment that we have doctor with us.
Thank you so much, sir.
Okay, yes. Over to you, doctor, for your presentation.
Yes, is my screen visible, sir?
Yes, it is visible.
Okay, sir. A very pleasant evening to one all gathered here. I'm Dr. Iniga. Today, I'll be discussing about mental health in general and stress management. Okay, first, what is health? The general idea is that
Ma'am, your screen is not staring, ma'am.
I changed the screen, sir. Is it visible, sir?
We can see you, but not your screen, doctor.
Okay. Is it visible, sir?
No, doctor, you could stop sharing and come back from the beginning, like.
Yes, sir.
Yeah.
Is it visible now, sir?
No, not yet.
Not yet. Okay.
Yes. Oh, it disappeared. All right, fine. Yes. Go ahead. Yeah. All right. Yes.
Yes, sir.
Yeah. Yeah. Fine.
Audible,
Fine.
sir?
Yeah.
Yes.
Audible. Yes. Yeah.
The general idea about health is that a person claims to be healthy when they're free of any illness. But the definition of health, according to WHO, is that it's a state of complete physical, mental, and social well being, and not merely the absence of any disease or infirmity. So, what is mental health then? Once again, people who think they have mental illness, they imagine someone who is abnormal, who talks differently from others, who behaves a little different than others. But once again, the definition goes as follows: a state of well-being in which every individual realizes his or own potential and cope up with normal stressors of life. They should be able to do their work productively and fruitfully, and not just do the bare minimum. When a person suffers from psychiatric illness, their thought, mood, and behavior can be affected. Why is there still a need for awareness? It's not like it is a very new illness. It's not like COVID-19, which happened like 4 years or 5 years back. It's been there for about 2000 years. Why are we still talking about a need for awareness? The main reason is that we commonly use certain terms like depression, anxiety, and all these things, but are we real what these illnesses are? The second reason as to why there should be an awareness is that the stigma associated with it should be removed. Stigma in the sense, when I ask my clients like if they had any, if they have any family history, or if they are suffering from any kind of medical illnesses like hypertension, diabetes, it doesn't seem like they have any problem disclosing it. But when I ask them, does anyone in your family have any kind of psychiatric illness, that is a hesitancy. Many times they end up telling me that like my family is perfectly all right. There is nothing wrong with my family. This happens because there is stigma associated with it. Third, we should encourage them to freely, openly talk about it. This is actually happening in the recent past because celebrities have actually started talking out loud about it. This was not happening some decades back, but in the recent past, it's been happening, and it's a very welcoming thing to do. Normalize it. Normalize. Only when an illness is normalized, then the population seeking help would actually increase. It is not a very uncommon illness. Psychiatric illness in general, every fifth person suffers from some kind of mental illness. So, why does a person get psychiatric illness? The common idea is that some kind of stress is what drives a person to become psychiatrically ill. But that might not be the scenario all the time. This we call biopsychosocial model. Psychological component, and social component, which altogether drives a person to become psychiatrically ill. The biological component includes the genetic predisposition, just like can be hereditable. This also can be hereditable. There is a psychological component, which includes our coping strategies, our pre-morbid personality, our behavior, our social skills, our emotions. This by itself changes from person to person, and this can push a person into psychiatric illness. Problem with that. Next, social or environmental causes. peer relationship, family situations, the culture in which a person lives, the social support, their education, their socioeconomic status, all together contribute to a person becoming psychiatrically that stressors cannot push a person into psychiatric illness. Very often we see that there is some kind of stressor, and often when a person becomes psychiatrically ill after a stressor, the prognosis is pretty good. So the common stressors include life events and daily hazards. Life events can be death or loss, which are significant, some a separation from their loved ones, retirement, being fired from job, even daily hazards like when they have too many things to do, when they wasted too much time and they have very little time left, basic change in the financial state, rise in cost, all these simple things, when piled up together, can also lead a person to become psychiatric. Now, let's discuss the common stressors in college students. Academic pressure, financial stress, lifestyle changes, especially when they are new to the college, and concerns about career when they're about to finish their course. Time management when they have finished their projects on time, when there is a timeline. Social challenges, if they are previously suffering from any mental illness. All these can be the common stressors in college students. Now, I'll be discussing a little in detail about a few very common mental illnesses. These are the common mental illnesses. The most common mental illness, which even lay people seem to use, is depression. Everyone, they almost diagnose themselves with depression before they come for help. They end up saying, "Madam, in depression, you could just give me treatment." They even Google search, come up with some medication which I should prescribe to them. So, what actually is depression, and how common is it? It is very, very common. In fact, depression is the leading cause of disability in the world. And about 300 million people in the world struggle from depression. And 12 billion working days are lost annually anxiety alone. This is pretty common among women when compared to men. And worldwide, about 10% of pregnant women suffer from postpartum depression. More than 7 lakh people die due to suicides every year. And suicide is the fourth leading cause of death among youngsters at 15 to 29 years old. So just like I told before, depression seems to be the very commonly diagnosed illness. If something bad happens in my family, if there is a loss, if I'm struggling with some financial crisis, isn't it not normal that I feel low? Many times, feeling low is often confused with depression. Depression is not just feeling low, it is a persistent and pervasive mood disturbance. That is, throughout the entire day, they feel low, no matter what they do. Often, when we feel low, we try to distract ourselves. We would do things which would actually lift our spirit. But in spite of doing everything, they still feel low. Another common symptom of depression is anhedonia. The pleasure that they derive from doing something which they like or any pleasurable activity, they don't derive the same amount of happiness they previously acquired. They feel excessively tired in the morning. They have sleep disturbance. The sleep can be less, or they might fall asleep, they can wake up. There might, especially in geriatric age group, clients often come with memory disturbance. That is because there is a impairment of concentration, and because they're not concentrating and doing a task, it's very difficult recollecting it, and it often presents as a concentration difficulty. There can be loss of appetite. There can be pessimistic suicidal ideation, so low self-esteem. These are the common symptoms of depression. These are the famous personalities who suffered from depression. Now, moving on to substance use. This over the last few decades has significantly increased, and initially the age of age when a person starts taking a substance was it was like around 17 or 18 years at least. Nowadays, I'm finding children around 10 to 12 years frequently coming with substance abuse. So how common is it? According to WHO, 57% of the global population reportedly consumed alcohol at least once in the last 12 months. And according to the National Survey of Extent and Pattern of Substance Use in India, 16 crore people between the age of 10 to 75 use alcohol. About 3.1 crore individuals use cannabis. Cannabis is what we call ganja. And opioid use is about 2.06, and 1.18 crore population use sedatives, and 1.7% inhalant substances, and 8.5 lakhs use injections. See here, opioid in India alone is 2.06%, and this is significantly higher than the entire world altogether. And what are the common causes why a person takes substance? There's a psychological cause. There's a calming effect. For a person who's actually anxious all the time or suffering from any anxiety disorder, this is self-medicative. It helps calming them down. So they have it and take it. Stressor. This is a commonly prescribed treatment by their peers or friends. They end up telling, like, you take alcohol or any substance, it's going to calm you down. So they take it for stress. Socio-cultural. This is in certain customs and certain events, consuming alcohol, some substance, for that matter, even cannabis, is socially accepted in certain situations. When a substance is socially accepted, the chance of a person taking that, when a parent consumes substance, once again, they set an example, and once again, the children might also consume the substance. Biological or genetic reason. This is, see, if two people, sir, am I audible? Hello?
You are audible, you are audible, yes.
Okay.
You are audible.
If two people consume a substance and the next day morning, one person ends up getting severe adverse effects, they end up having, they vomit blood, or they have severe headache and so much side effect, while the other person is very comfortable, they don't have any hangover. Who's more likely to take the substance? The person who didn't have much side effects. This by itself has a genetic backing. Some people can tolerate the substance better than others, and there's a genetic backing, and it's a very risky thing, because once your parent ends up taking it and is able to tolerate it well, you also might have the same genes which actually help you to tolerate the substance better. Next is biological, genetic backing, and then psychiatric illness by itself can promote substance use. Many times when I ask clients, they end up telling me, ma'am, the substance is under my control. Initially, I thought I was just taking it for fun, but now it's difficult. This happens because when we do something that we love, or when I eat my favorite food or go to my favorite place, when I hang out with my friends, I feel happy. That is because there is a pathway in the brain called reward pathway that gets activated. The same pathway gets activated when a person consumes a substance. That leads to the pleasurable effect. And when this pathway gets activated, there is a need to take it once again, because the person remembers how it actually feels when they take this substance. When they regularly take a substance, it can lead to dependence. Once a person enters this dependence phase, it's very difficult to come out of the substance. Tolerance. Initially, when a person takes substance, when they take it in smaller quantity, they get the high. But this quantity gradually starts increasing, and some people even come with, they claim that they take 3 to 4 quarters, fulls, to get the same high they previously derived with a single quarter. And when another reason why a person still continues to take the substance is withdrawal symptoms. When a person regularly takes a substance and then stops it abruptly without any medical help, it becomes very difficult. They have severe side effects. Sometimes they might have auditory hallucinations, they might have visual hallucinations, they might have delusions, they might have severe confusion, disorientation, and all these can happen, not just tremors. So when that happens, it's a little scary. And once again, the person tends to take the substance. So these are the things that can happen at various levels of blood alcohol when a person consumes alcohol. Now, the common complications include the physical complications include gastrointestinal system, nutritional deficiencies. There can be anemia or blood values can change. Cardiac can arise. The most dreaded complication it's a non-reversible memory disturbance. There can be metabolic side effects and so on. In certain scenarios, substances can cause cancer as well. Next, obsessive compulsive disorder. Many times this is confused with being excessively clean. That is not the scenario. Obsessive compulsive disorder is not just being excessively clean. It is, let me share a small story. There was one client who came to me. She was like, this is one of the most debilitating disorders. She's a very well educated female who has 3-4 degrees in her hand, but was not going to work. When I asked her as to the reason why she's not going to work, she's telling me that it takes me the entire day to clean the house, so I don't have time to go and work. Her house is not that big of a house, but the problem arises because she cleans the house once. And when she rinses the mop, the water has to be clear. She mops it over and over again until the water that she uses to rinse the mop it turns out to be almost like the same as she takes it from the tap. So it takes her hours and hours of just doing it. So obsessive compulsive disorder is in this, a person suffering from this might have repetitive unwanted thought, which the person will identify that it's an unnecessary thought, would try to stop it, but will not be able to stop it. And in order to correct that, they might develop a behavior, which if they don't do, they'll feel excessively stressed. Can either they excessively clean their hands or mop the floor, or it can be counting or doing things a particular number of times, or being very to the point certain things have to be in a certain place no matter what. Even if they leave the house, or even if it's not their own house, they would come back and they would make sure it's in the exact place. It can be they might say it might be real seeking, or like so many subdivisions of this, and these are the famous personalities who suffered from it. Next, schizophrenia is one of the most dreaded psychiatric illness. It has a long-time course, it's a continuous illness. And in the recent times, many movies are trying to mimic schizophrenia, often not correctly, but the most common thing that they show is hallucinations and delusions. Please excuse me. So, the symptoms of schizophrenia, we can divide it into 3 groups: positive, negative, and cognitive symptoms. And we have hallucinations, delusions, disordered thought, and behavior. Negative symptoms, we have apathy, anhedonia, aversion, affective blunting, asociality, and all this. They might also have cognitive difficulties. All the basic things that we think a person need not think twice, like when we go to an event, just to greet another person, just saying, hi, how are you? Are you good? Did you have your lunch? Even those basic things would be very difficult for that person to catch. Those non-verbal communication become very difficult for a person suffering from schizophrenia. Okay, to explain schizophrenia in short, this is actually a self-portrait of an aspiring artist by the name Day19. What he did was he suffered from schizophrenia. And over the course of the illness, he gradually started decreasing his medication and finally stopped the medication. And at various stages, he actually started recording his self-portraits. Progress. In the first, he felt like there are some waves around being emitted out of his body. In this picture, the blue, in each picture, he actually started describing it. The second picture, he started claiming that he was feeling very depressed. The fourth picture, he started claiming that his head was in the enormous mouth, which was actually blurting out all his secrets. In this picture, he started saying that somebody was controlling. This was all the same self-portraits of himself, which describes the cause of the illness. Shows the progress of the illness, and finally committed suicide and passed away right before he passed away, a few days before he drew his final picture. This once again is a self-portrait of himself. That's how much it affected his thought. These are some of the famous personalities who suffered from this particular illness. Next is bipolar affective disorder. Previously, I discussed about depression. In bipolar affective disorder, a person might have, it's an episodic illness in the sense, a person might have an illness for a few months, be symptom-free for a few months, and once again, they might get the illness. It can either be recurrent episodes of mania or hypomania or depression. A combination of everything together can happen. So what are the symptoms of mania? In depression, just like a person feels excessively low, in this a person can feel that is persistent, pervasive, elated or irritable mood. And they might be full of energy. They might stay up the entire night. There is a decreased need for sleep. Once again, the sleep is disturbed here, but a person with depression would stay up in the night because they're not able to sleep. In this, they might feel like there is no need to sleep because they feel very, very fresh. Even after not sleeping the entire night, the next day morning, they'll be full of energy. Then they might talk to complete strangers as if they've known them for years. That is called over-familiarity. There can be flight of ideas. They might be talking about one topic, then they might skip to the next topic so rapidly to the point it becomes very difficult for us to even follow what they're saying. There is pressure of speech. They talk at least more than 160 words per minute. It becomes very difficult to follow them. There might be increased sexual desires, increased religiosity, and increased risk-taking behavior. It is episodic illness. Sometimes they might have a mixed episode where depression and manic symptoms happen together. These are some of the personalities who suffered from bipolar affective disorder. Next, talking about stress management. When we are all in college, we would have frequently heard our faculty saying this. You need to be stressed, be casual, be relaxed, but make sure you clear this exam. If you don't do this, you're not going to get anywhere. This is going to determine your future. And all these kind of things, little things would actually make us stressed. Is stress a normal thing in the first place? The fact is it is. It is a very normal response to a stressor. What is a stressor? It can either be internal or external. It is usually a circumstance that is difficult, upsetting, and scary. Common internal stressors include distressing thoughts or memories, physical sensations like pain or discomfort, sadness, anger. And external stressors include concerning events, situations, or circumstances that have a potential to negatively impact a person or something that they care about. So, I previously said that stress is actually useful. How is it useful? It is a very necessary part of our life. Often we complete a task only when it's the last minute, only when there is a need, only when there is a stress, we often end up doing it. When the stress is absent, we tend to not do it. So it stimulates us to act, think, or react. It creates a personal developmental opportunity, and it forces us to accomplish certain tasks and especially on time. So, what are the common causes of stress? Previously described about a few things that can cause stress. So, the common cause of stress are effects of change. When you know if this particular thing happens, it's going to change things, then you might be stressed. When an outside force is challenging or threatening to you, when we have previously never been in that situation and we find that very threatening, we don't know how to tackle the situation with our previous experience, then we might be stressed. When there is a feeling of losing one's personal control, then once again, a person might be stressed. I previously told you that stress is good, but there are two kinds of stresses. One, a good stress, and the next one is not that good. Eustress is generally considered the stress that is positive, motivating, and which enhances the functioning of a person. Distress is usually the bad and overwhelming stress that impairs a person's function. common examples of eustress and distress are as follows. Eustress, like when we have sports or culturals, when you're preparing for it, it's a little stressful, but we still seem to enjoy it. It gives you a happiness. Riding a roller coaster, getting married, going to a new place or going to a new home, beginning a new job, having a baby, studying for an exam, giving a speech, traveling, all these are examples of eustress. Examples of distress are any loss in the family, getting divorced or separated, losing a job, any kind of chronic illness or financial problems, when they're coping with addiction or any kind of abuse, physical or mental, any mental illness or natural disasters are common examples that can lead to distress. Okay. This Yerkes Dodson law, it was actually a study done on mice. What they ended up doing is they passed currents of degrees on mice and uh, motivated the mice to do certain activities like completing the maze. What ended up happening was when the current was actually very little, this is what happens. The mice were either intact or laid back. They were not doing any activities. They were just chilling. So when the current was a little too high, what ended up happening was the mice started getting fatigue, exhausted. They started feeling very anxious. They break down and complete burnout. When the current was actually the optimal level, their productivity was at the maximum. So this was to show that when minimal stress is there, it's of no use. When maximum stress is there, it exhausts the person. When the stress is at the optimal level, a person's functionality significantly improves. The possible impacts and impairments due to distress. So there might be, once again, any kind of psychiatric illness can arise out of it. It doesn't mean that any person having stress will just develop depression based on their genetic makeup or based on the situation. The illnesses and the premorbid personality plays a major role also. They can develop different kind of psychiatric illnesses. The common symptoms include trouble getting sleep or staying asleep. There can be physical pain. Study shows that when a person is actually happy, the pain that they feel is way lesser. When a person is stressed or when the person is actually suffering from depression, our brain perceives the pain significantly higher than what it actually is. There can be either an increase or decrease of appetite. They might feel keyed up or on the edge or restless. They can have racing or repetitive intrusive thoughts. They might feel exhausted, drained. There can be impairment of functioning either in one or more areas of their life. There can be an increased risk of substance use, and they might develop some chronic, even medical illnesses after a stress. Many times we develop some kind of unhealthy coping strategies to cope up with stress. These unhealthy coping strategies are usually irritability or violence, disruptive eating patterns, excessively eating, compulsive shopping, harsh treatment of others, being abusive towards others, increasing the consumption of any substance or any pills or any drugs for that matter, rash driving, or completely shutting down and isolating themselves from others. These are the common unhealthy coping strategies. So, what is self-compassion? I talked about the unhealthy way of coping up with stress. This is a healthy way of coping up with stress. We generally think that when we do something wrong or when we commit a mistake, we should be the first person to be very critical with ourselves. We are usually very critical with ourselves. But study shows the other way around. It shows that self-compassion is better than being self-critical. This is found to be more motivating, helpful, and more likely to lead us to a success than being excessively critical. So how do we practice self-compassion? We should be aware of what others tell us matters, but what we tell ourselves matters more than that. We take that more seriously. So beware of what you tell yourself. Comfort yourself. Nobody gets a personalized cheerleader. So be your own cheerleader. Tell yourself it's going to be better and tell that are going to be better days and comfort yourself. Own your own mistakes. First, understand that it was a mistake. Don't be too critical, but understand the mistake so that the next time you can correct it. Treat yourself the same way you would treat others, with empathy. let go of the past. Don't keep bringing back the past and telling yourself you're a failure and all this. Forgive your mistakes and practice positive and encouraging self-talks. Instead of saying I'm a mess, you can tell yourself I'm a human. Human beings tend to make mistakes, so it's all right. Instead of saying I can't do this, you can tell yourself, see, I've previously done hard things. I've overcome a lot of things, so I'm going to make it this time too. Instead of saying I'm a failure, you can tell yourself I'm learning. I'll be better next time. Instead of saying why is this happening, you can tell yourself what is this actually teaching me? What can I do better the next time? So, coping with stress, how do you do that? Build resilience, develop healthy coping strategies, use some kind of relaxation techniques, seek help whenever required, plan your time accordingly. Look for opportunities for self discovery after a struggle with loss. Develop self confidence. Consider the stressful event in the broader context instead of just being like, okay, this is going to determine the entire life course. Tell yourself, like, see, after a few years, it's going to get better. Probably this is for the best. Maintain a hopeful outlook and expect good things. Take care of your mind and your body together. So, the pickle jar theory, it gives you an idea as to how you should prioritize your time and plan things. Consider the time that you have as a jar. First, fill it up with rocks. Rocks are the most represent the most important task or the high priority tasks which are very important that has to be done that day alone. Within that day, it has to be done. So those are the rocks. Then first fill the jar with some rocks. Then fill it with some pebbles. Pebbles stand for smaller tasks with lower importance but still has to be done right away. Then comes sand. Fill it with sand. That is a less important task which you can probably do the next day also. Then finally, pour some water in it. Water stands for family and your private time, things that you relax. So this is not what should be done for the entire year. It's one single day should compose of all these components. So it helps you plan your time better. And when you plan your time better, automatically you'll have ample amount of time and the stress that you're going through will be significantly lesser. So when you try all these things but still not feeling better, then seek help. When do you actually need to seek help? When overwhelming stress beyond any individual's capacity to cope. You tried your best to cope, but still you're not able to do it. Then seek help. When there is not much social support, when the family doesn't understand you better, or you feel like your family, there's no point telling your family, nothing is going to change, then seek help. When you have exhausted all your existing skills, but still you're not able to recover from it, seek help. You then finally, when the mood disturbance or any disturbance for that matter is persistent or pervasive, definitely seek help. When your biological functions are affected, like sleep is affected, appetite is affected, definitely seek help. Any suicidal ideation, even if you think that's not that significant, help should be sought. Now, summarizing, maintaining a healthy mind and healthy body will help you cope with adversities. Simple and effective techniques will bring impactful improvement in the quality of life, and help is always available. Thank you. Sir?
Thank you, doctor. It was a wonderful presentation. We covered many of the psychiatric issues.
Yes.
Very well taken. Yeah, even
Yes.
for me, some of the concepts are very new, like eustress. So
Okay.
uh,
Thank you.
probably, I guess many of our participants will have similar questions. Participants,
Yes, sir.
yeah, you can. Doctor is available. Um, you may come up with your questions and clarify your doubts and clarifications. Yes, Mr. Mohan, kindly unmute the mic of Dr. Vijay. Yes, you can unmute yourself. Mr. Mohan.
Hello, Vijay.
Just hold on, yes, yeah.
Yes.
Sir, done, sir.
Oh, yes, okay, yeah. For the first was, Vijay.
Yes, sir. Good evening, sir.
Yeah, good evening, ma'am. Yeah.
Good evening, ma'am. There are two questions for
Good
me.
evening.
You
Yes.
told that there is an increased risk of chronic illness after stress.
Yes, ma'am.
If illness is the cause of stress, how can we manage it, ma'am? First question.
Yeah, okay. Yes, ma'am.
Second question, what is biofeedback technique?
It is actually one of those. Ma'am. First, coming to the first question, what was it, ma'am? Okay, illness. Yeah, it's a vicious cycle, ma'am. Thing is, any chronic illness can be a stressor by itself, and if a person has, any, whatever is it? What was the question again, ma'am? First question.
Ma'am, could you come up with your first question, Vijay?
Yes, sir.
Vijay, ma'am?
Yes,
Yeah,
sir, yes, sir,
please
yes,
take,
sir. I'm
yeah,
on.
take one question at a time, yes.
If illness is the cause of stress, how can we manage it?
And the thing is, it's not like always like, see, many patients have cancer. Many of my patients. Not everyone who has cancer actually finds it very difficult to cope up with it. When your coping strategies are a little better and you have a lot of relaxation techniques, you can actually prevent it. When your support system is actually significant, many do not even develop any kind of depression or even basic adjustment disorders, they do not develop. But the premorbid personality is what actually drives a person into psychiatric illness in such scenarios. If previously said they were a very anxious individual, they had difficulties coping with smaller stressor, then a chronic illness would be even more of a stress. Getting a terminal illness or something which they know they have to take medication for the rest of their life is going to be much of a stress. If that particular stress drives a person into a psychiatric illness, they might need medical help, ma'am. It's not just coping strategies or relaxation techniques by itself is not going to help. This is because of basically any psychiatric illness happens because of changes in neurotransmitters in the brain. The level of neurotransmitters is that they are basically some chemicals being secreted in the brain, which determine a person getting depression or anxiety or any kind of.
Actually, from business point of view,
Ma'am, me too is a cancer survivor.
Oh, yes,
I'm
ma'am.
trying a lot for my positivity and I'm very strong. I'm doing everything okay. But even though this all are going for me, sometimes I feel very depressed. So
Well, that's
I'm asking
because
this
if
question.
a person is therapy and counseling helps a person, ma'am, but not to the point a person can. When the depression or anxiety or any psychiatric illness for that matter is in the milder stage, only therapy alone can help, ma'am. If you've entered the next stage when it's moderate to severe, just therapy or any relaxation techniques by itself will be enough. Once your biological functions are being affected, when you realize that you're not your previous self and you're not able to do your activity just as efficient as you previously did, then you might need medical help, ma'am. Without medical management, your neurotransmitter level is not going to increase. If that's not going to increase, you're not going to feel better, ma'am. So when I start you on any medication, you'll definitely find an improvement. That basically means that all your existing strategies are not enough. And just therapy alone is not going to be enough.
Thank you, ma'am. Thank you. And
Biofeedback is by the topic for by itself, ma'am. It's like just like ECT. It's
yeah.
one of the things we use for anxiety disorders, panic disorders, and all those things, ma'am.
Okay. I'm trying to manage to the best of me.
Ma'am, it's actually you needn't suffer in silence, ma'am. Many times my patient keeps saying they feel guilty for not being able to cope up. Sometimes, no matter what you do, you cannot cope up. For example, ma'am, if I attend a function my brother's wedding or my cousin's wedding and I stay up late for 3-4 days. The next day I have to, if I'm put in a situation where I have to take a lecture or listen to a lecture for that matter, I cannot do it effectively. So when a person has significant sleep disturbance or mood disturbance for weeks or months at a stretch, it is impossible for them to be their previous self. And there is nothing wrong in getting help. With medication, medication takes about 2 weeks to act, ma'am. By the time it's 1 to 1.5 months, you'll have significant improvement of symptoms. I would suggest getting medical help.
Oh, sure, ma'am. Thank you.
Thank you.
And my second question is, what is biofeedback technique for
Yes,
stress?
ma'am. Yeah, once again, that is something which you implement with the help of, it has to be done with instruments, ma'am. That's why it's a topic by itself. Biofeedback is like if you need help, if you think you need help with the biofeedback machine, you can go to some medical college nearby and they'll have the device, they connect you with so many things which monitors your, like, hello? Hello?
Ma'am, can we go for this feedback as of,
In,
or whether we have to go with some doctor's prescription?
ma'am, as far as I've seen, medication helps. There's quicker response. The medication definitely significantly helps.
All right.
I
So
would advise going for biofeedback instead of like picking up an instrument or a type of treatment. It's better to go consult a psychiatrist so that they can start you on medication if it's required, ma'am. Mostly, you might need medication. There are so many safe medication which you can take it along with any other medication you're taking as well.
okay.
Hello?
So shall we take up the next question?
Thank you.
Yeah,
Thank you.
Yeah. Okay. Welcome, ma'am. Yeah. Yes.
Yeah, ma'am.
Hello, sir. Hello, ma'am. Good evening.
Hello, good evening.
Ma'am, through the session, there was one point where a person commit any mistake or when a person is undergoing a lot of stress or something, they try to isolate themselves and they don't talk up too much or they keep themselves somewhat very closed and they don't open up. So how long, if it is going to lead, it is a good one, or how long if they come out of it, it can be a good one?
Ma'am, actually, isolating themselves can be part of any major psychiatric illness as well. For example, schizophrenia, one of the most common symptom is asociality. Okay. So that person basically isolates themselves. They do not talk to anyone. So that cannot be taken as a sign which you can wait upon. In general, just if it actually exceeds more than 2 weeks, is better to get medical help. Do not wait more. If the stressor is a little more, it is the quicker you start the person on medication, the improvement is better. So you needn't wait for longer duration. That is
I
not
have
actually
another two
advised.
more questions, ma'am. Will there be a difference of time frame for schizo patients, for OCD patients, for autism patients, or it will be the same time frame of 2 weeks for all the patients?
No, ma'am. It's different for different illness. In order to each, you can look at ICD-11, ma'am. ICD-11 is the most recent diagnostic criteria. For each illness, the duration, if I have to say a person has schizophrenia, there is a whole bunch of criteria, and it's prescribed that so many of these criteria should be present for at least 1 month, according to ICD. So depression, it has to be at least for 2 weeks. It's not just 1 or 2 symptoms. It's a whole bunch of symptoms and so many number of symptoms.
ICD symptoms, I understand. I do
Yes,
understand. Now,
it
how to
varies.
relate
It
the
is difficult.
same thing for a human, like who doesn't have any issues like OCD or ADHD or hyperactiveness? How to relate the same scenario for a normal human? Like if you scold a kid, the kid will be isolated for an hour or two, or within 15 minutes they come back and speak, or throughout the year they will not speak to that particular teacher or something. So how to deal with that?
Ma'am, just uh, we cannot come to a conclusion of a diagnosis just with a few symptoms. Certain symptoms can be very normal.
No,
A child.
ma'am, sorry, I think I have to rephrase the question. I'm not rephrasing it correctly. It's
Okay.
not about the patient at all over here. It's for a normal human without any type of disease or issues like this. Will they feel the same kind of thing, or will they be able to come out? Just correlating the scenario, if you're scolding a kid for making a mistake as a parent or as a teacher or as a tuition teacher, the kid may not talk for a day or two or for an hour or two. Is it quite logical world, or is it an illogical
It's very normal if the child doesn't talk for a few hours or a few weeks, even, ma'am. If the child ends up holding grudge or doesn't talk to that particular person for weeks or months at a stretch, then that is concerning. The child, once we say that a person has a personality disorder only after the person turns 18. So when you actually promote such kind of act to the child, it might learn wrong coping strategies and might learn wrong things, and ultimately it might lead to a personality disorder. That's even more difficult to treat. It's not like other psychiatric illness where I can give medication and expect it to change. A person has a pre-morbid personality, then they are prone to certain psychiatric illnesses.
Yes.
So preventing a person from developing a psychiatric illness is very important. You can just tell the child, see, certain times things might not go the same way as what you expect. You need to look at things as black and white. There is a gray area in the middle. This can be cultivated in the house itself, instead of just ignoring what the child is doing or going along with the flow, just saying, yeah, that's probably wrong. What they did is probably wrong. You probably shouldn't talk back to them ever. Saying that, you can teach small strategies like just, okay, that's okay. Human beings make mistake. I understand what they did was wrong. But in order for you to feel better, you just forgive them. You forget things. Those things are simple things that a parent can probably say, or if the client comes to you, can tell them. Usually with children, they're very malleable, ma'am. Just small ideas that you give, small strategies that you tell them, they'll take it seriously and implement it. The problem arises when the child is not taught any of this up until a certain age. And after the personality gets established, it is usually when the child or the
Yes.
person comes to us.
Yes,
Then it becomes very
nowadays we are
difficult.
feeling the same after the COVID things.
Yeah, it's very common. Many times the parents actually encourage it. When they say they don't like a particular child in their school, or when they don't like their particular aunt or uncle, nobody tells them that it's not okay.
Yes.
Nobody tells them, see, just forgive those things. Instead, they either keep silent or they add fire to the fuel. So, I mean, fuel to the fire. So that ends up being the problem. It by itself doesn't contribute to any psychiatric illness. Might be just a normal.
CBT works here, ma'am. CBT, cognitive behavioral therapy can be made, no, like writing, making them to realize.
Therapy is the mainstream of management for personality disorders, ma'am.
Okay.
Personality disorder by itself, it's not a thing which you give medication and treat it. Therapy is what we ask them to go meet a psychologist. When a person comes with only personality disorder, and usually that is very, very rare when a person comes with just personality disorder, because the insight is not there for the illness. Insight is when a person knows that they have an illness and that they should take treatment for it, and that if they take treatment, they are going to be better. That is often not the case when a person just has personality disorder. It's often their spouses who bring them and say, like, because of how they are behaving, I'm end up getting sick or he is getting sick. So, that is the main stream of management for a personality disorder.
All right, so we take up Shubha. Ma'am, you can ask a question. Shubha,
Hi, sir.
are you there? Yes, yeah. You can come on the video. You can ask.
For me, go ahead.
Yeah, go ahead. Yeah.
Sir, in regarding the unhealthy ways of expressing the stress, ma'am has discussed. In the alternatively, what are the healthy ways of expressing the stress? Like,
Ma'am, I already presented a few slides
can
also
you
on
tell,
it.
yeah, little detail, ma'am, that I didn't get? That
Which, ma'am?
mainly
Which?
for infertility couple, ma'am. If the
Okay.
infertility couple, they are facing the stress, either the mother or father. So for them, what advice I can give them? How to cope up with their stress? What advice?
Yes, ma'am. The thing is, hope everybody here is above 18, sir. Yes, sir.
Yes, yeah, all of us.
Okay. Yes,
Yeah.
sir. Just to be on the safer side. So the thing,
Yeah, all are above 18, yeah.
yes, infertility by itself is a very stressful phase, ma'am. It takes the fun out of certain things. Their sexual life becomes very strained. So it's a very difficult phase that they go through. Or from a psychologist point of view, you can tell them just to not be worried about the outcome, to spend more time with them. And not all the time should their intimacy end up in a sexual act. So when a person suffers from infertility, it's always about the particular time that they have to do it on a certain day, and this becomes very stressful. And that is the reason why a person gets stressed. Ask you can find ask them to spend more time together, ask them to go out and relax and just like they can watch a movie, just other small intimate things which does not culminate in sexual act. This is what we usually tell ma'am.
Okay, what
Because
is the
what they
dyadic
concentrating is
coping?
on the act. So
Okay. And regarding the dyadic coping among the couples, how I can motivate the dyadic coping?
dyadic coping, ma'am.
Yes, dyadic coping is like togetherly they will cope up with the stress, they will build resilience to face the
I mean,
stress.
the thing is, ma'am, as psychiatrists, we
Okay.
don't concentrate much on therapies and such.
Yes.
It's mainly medication and a few brief therapies is what we concentrate. So I'm not actually an expert in talking about therapies in detail.
Thank you, ma'am. Thank you for your information.
Yes.
Okay, so we have Premlata. You can ask a question to doctor. Premlata, are you
I'm a
there?
clinical psychology
Yes.
student, ma'am. I
Okay, you
have
can
seen one
come on a
case.
video so that it's clear. Your question is clear.
Hello, Premlata.
Ma'am, I'm a clinical psychology student, ma'am. I have
Yes,
a
ma'am.
doubt regarding a case, ma'am.
Yes.
I have seen one case in which he had a selective mutism up to its 10th standard, ma'am. Due to that,
What what happened?
selective mutism
Okay, selective
up
mutism.
to
Okay.
up to its 10th standard. Due to that, he was facing so many interpersonal deficits with the interacting with people, ma'am. Due to that, it developed as a social anxiety in which he afraid of standing in front of a crowd and speaking in front of others like that. He was so due to that issue, he also developed a phobia towards the higher authorities and all. In that case, what kind of therapy will be work out, ma'am?
Just like I told before, for this particular patient, the mainstream of treatment is it's not therapy. It is medication. See, medication is the pharmacological manager is the mainstream of treatment. Selective mutism by itself can be a psychiatric disorder, like it's an anxiety disorder. So this is once again because of deficits of certain neurotransmitters in the brain, and this has to be replaced using medication. Once the anxiety level comes, because one anxiety disorder does not just stop with that, it leads to another anxiety disorder, and they might develop a whole bunch of disorders from the anxiety spectrum. So sending the person to get medical help and then starting therapy would be the best possible thing to do. Only because, see, I can make a person sit and talk for hours and initiate a therapy. If the person is sleep deprived and their anxiety is so high, they won't be in a state where they can actually listen to you and implement what you're saying. If that's a scenario, then therapy does not work at that point. So wait a little, let the person, wait for the person to be started on medication and let the anxiety level go down a bit, then initiate the therapy.
Okay,
Okay.
ma'am, but
For the
we do have a intrusive thought, repeated intrusive thought per day. He has the thought for up to 1 hour, ma'am. Due to
one
that, his daily life activities also getting
once
worsened.
again, OCD also still those intrusive thoughts are OCD symptoms, OCS. We call it obsessive compulsive symptoms. That once again falls under anxiety disorder. One anxiety disorder, if a person has an anxiety disorder, it's not like textbook. It's not like one particular um, uh, disorder alone comes for a person. It often coexists with so many other psychiatric illnesses. So in this particular scenario, when they have multiple difficulties, mainstream is medication. First, let them get medical help, and then we can start on therapy.
Okay, ma'am.
Okay,
Thank you.
welcome.
Okay, so Dr. Jnana Saraswati, are you there? Yes, next will be Anita Mary, yes.
Good evening, ma'am. Good evening, sir.
Good evening, ma'am.
Ma'am, I have a question regarding the people, the women at the menopause stage.
Yes,
During
ma'am.
this menopause stage, we all of us know that the periods are not regular and the changes shifts. And during this time, the around the date which we are supposed to get 1 week before and after, extreme sort of depression and extreme low feeling and extreme anxiety, extreme anger and irritation and all these negative feelings when they dodge us, should we go for therapy or is it a psychiatry problem? Do we have any psychedelic drugs to treat in a minimal dose during this period? Because even though we are educated, we know what happens during these stages, menopause stage. The feelings that we undergo or the trauma we can say that we undergo it seems like really unmanageable and gives a insecure feeling even though we are very much secured mentally and physically and in all other possible ways being educated, but because of the hormonal imbalance during this time, is it really to be treated medically or to be treated psychologically or psychiatry intervention is needed, or is there any psychedelic drugs which would make them to feel better, especially for women those who are going to work during this period is really a nightmare. Can you please suggest something and guide us properly on this, ma'am?
Yes, ma'am. Thing is, it's not just during menopausal stage. Menopausal is difficult, and that can lead to depression also. And premenstrual syndrome by itself is very stressful. If it's just very mild, if it's in and around that before that menstrual cycle, if they have some irritability, but they're able to manage, they're still able to carry on their daily activities in spite of them feeling a little irritable, in spite of them having some sleep disturbance, everything they're still able to manage and do efficient job, then therapy might help, ma'am. Once if this is a frequent cause of fight or argument between the spouses and is making them very bitter and they are really dreading the next menstrual cycle, for that matter, they're so scared that the next cycle is going to come, if it's that significant, then therapy alone is not going to help, ma'am. Definitely need medication. There are medications both for those premenstrual syndrome and also for the menopausal depression and everything. Those still medications are available. Depending on the intensity for any psychiatric illness for the matter, if it's mild, if it's not affecting their biological functions, if it's not affecting their daily activities significantly, then therapy can be the first uh, uh, treatment. I mean, first mode of treatment. If it goes into that moderate to severe range, then therapy alone is not going to be effective. You should definitely start them on medication. Then later you can start the therapy. You should know when to actually we diagnose the patient correctly, send them to a psychiatrist, get the medical help, and then come back, ma'am. Otherwise, the client is not going to be very satisfied. They would repeatedly keep coming for therapies, but when they don't find significant improvement, it's going to be very distressing, especially when biological functions are affected, daily activities are affected. Medical treatment is psychotropic medication is the only it's the mainstream of treatment.
Thank you so much, ma'am, for your clarification. Thank you.
Yes, yeah. Antin Mary.
Good evening, ma'am.
Good evening.
Yes, yeah, you're audible, yeah.
Actually, for some details, you were suggesting medication. I thought in other way, when there is a good support system and you
Yes,
have
ma'am.
a way out of, I think medication won't be necessary. The support system when missing.
Now, the thing is, support system, when a person is actually, let's take a depression for that matter, because it's the most commonly diagnosed illness. Support system, because for schizophrenia, support system is not going to help. They definitely need medication. So,
Oh,
I'm just talking about milder depression. The problem is when a person is actually depressed, even if the entire support system tells them, see, you're not, I understand that you're in a pit, but the pit is just 2 foot deep. It is not 9 or 10 foot deep. You can step out. I had previously gone through this. That's the common advice you actually hear from the support. It's not that big of a matter. We are there. We are going to make it out. But that person, because of the depressive cognition, they cannot feel the same thing that you're saying.
okay. Okay,
It
and
is
one
impossible for them to actually take it serious. That's what I'm saying. In order to take the input, they need certain amount of neurotransmitters in the brain. And if that is significantly low, no amount of advice or counseling or therapy is going to help. That
but
initial kickstart you need.
more of awareness of
Huh?
we have now more of awareness of just go around the nature, uh, have some more like connections with, like, you just don't go in for immediately for medication. More of awareness is there, right? So when people don't use it, they may come for medication. Another thing, when medication, a bit of addiction is there, no, ma'am. But you depend on that.
This is actually a myth, ma'am. Not all psychiatric medications are addictive. Only the benzodiazepine group is addictive. That is, those sleep medications alone are addictive. That's a general idea. For that matter, not just psychiatrists prescribe many of the medications that psychiatrists are prescribing. Many times, neurologists, general medicine people prescribe the same medication. The idea actually lies in our head. We end up thinking that the medications prescribed by psychiatrists are actually addictive. Not all groups. Not the medication that you give for depression, that's not addictive. The thing is, medication has to be taken for a particular group of like period of time. Many times when the patient does not take the medication for the significant time, or when they stop it abruptly, they will once again feel discomfort. They might feel uncomfortable because once again the neurotransmitters in the brain are dropping down significantly.
Okay, ma'am.
That's not because they are addicted to it. It's rather because they stopped it a little too early or a little too quickly and not in the correct pattern.
Okay, ma'am. Thank you. And then I was seeing few people after medication, they are not as normal as early. Like they put on weight and they're kind of a little bit of different behaviors. Like they are feeling weak.
Ma'am,
Some kind of thing. Yeah.
yes, ma'am. Depending on what they were taking. See, for example, if a person has first presents to me with depression, depression is of two types. That is bipolar depression and unipolar depression. So the group of medication that I have to give for bipolar is different from unipolar depression. But when a person first comes to me, it's impossible for me to diagnose which is what. So when I prescribe an antidepressant to that patient, the patient might get a manic episode. So all that you need to do is send them back to the psychiatrist so that they can alter the medication. You need to add another mood stabilizer for them to be all right. So without knowing what the actual scenario was, ma'am, I don't think I'll be in a state where I can
Thank you.
comment on it.
Okay, so good. We take the question from non-Malar. Yes, you can come on the video.
One
So,
second. I'm getting a call from the hospital, sir.
Ms. Usha Rani, could you mute your mic, please? Usha Rani, mute your mic. Doctor has got a call from. Kindly hold on. Kindly hold on. Doctor will come back. Yes.
Yes, sir.
Suddenly a phone call. Hello. Yes, Usharani. Yes, Usharani. Kindly mute your mic.
நடக்க வீட்டுல ஒன்றும் பிரச்சனை இல்ல
Usharani,
வலிக்கல
kindly mute your mic.
லைட் கொஞ்சம்
Remove பண்ணு.
கொஞ்சம் சாம்பார் மட்டும் லைட்டா சாப்பிடும் அப்புறம் ஆப்பிள் ஜூஸ் குடிச்சிச்சு அப்புறம் மாத்திரை சாப்பிடறாலும் எம்டியா சாப்பிடறாங்க
Does anyone else have questions, sir? Hello?
Hello,
ma'am. Am I audible?
Yeah, you're audible.
Sir, you're in mute. Sir, you're in mute.
And actually, one of my cousins was diagnosed with this bipolar disorder, ma'am.
Okay.
And having these episodes on regular basis, and he's going to treatment, and he's put on medication and some psychotherapy. Is there any hope of cure?
Ma'am, any psychiatric illness, there is nothing called cure. You treat the person. Certain illnesses are episodic, certain illnesses are continuous. Bipolar disorder, for that matter, is an episodic illness. So what ends up happening is, it is very easy for a person with schizophrenia. The attenders understand that the person has to be regularly on medication, and if they stop, they get the illness right away. The same is not the matter when a person has bipolar affective disorder. They'll either have a manic episode or depressive episode for a certain period, and then there'll be symptom. So this is a period which we actually suggest taking the medication. There's a certain protocol, ma'am. If it's the first episode, so many years, and there's a protocol for how long you should take the medication. When a person suffers from bipolar, they often do not take it for the prescribed amount of time. So that is the reason why the episode becomes more frequent and more intense.
Yeah, he is actually resisting to take the medication, ma'am.
Yes,
Yeah,
ma'am. When you take the medication, the episode becomes very, very frequent, to the point initially it would have been once in every 4-5 years. Later it becomes once in every 2 years, 1 year, and finally sometimes it's almost through the entire year they'll keep having one episode or the other.
I'm seeing the pattern.
So medication is definitely the mainstream for bipolar, ma'am. Even when they're not actually all right, they should still continue the medication until the psychiatrist prescribes. They stop medication, definitely there'll be issues.
And one more small thing. Ma'am, he is young. Actually, he is 30, and he wants to get married. Is that okay? Can we look for someone? I think your video is stuck.
Divya?
Sir, shall I wait, sir?
Dr. Divya is off the screen. Just hold on, she'll come back. I think she's gone off the Zoom. I don't see her.
Okay, sir. Then I'll.
Yes, yeah. We'll take it up later. Tomorrow we have a clinical psychologist. We can take up later. Not an issue. Yeah. Yes, she's calling me. Hello. Yeah. Oh, okay. Oh, I see. Okay. The meeting is almost over. You want to propose the vote of thanks? Can you just come back? Okay, rejoin, please. Yeah, rejoin. Yes, yeah. Just rejoin. Yeah. Is rejoining. Yeah. Rabia Begum, you can be ready for proposing vote of thanks.
Okay, sir.
Yeah, okay, yeah.
Yes, sir.
Oh, yes, you're back. Yeah. So, ma'am, there are a lot of comments that are posted in the chat box. Session was very excellent. Very lot of clarity is given. So many comments are there, and thank
Yes,
you
sir.
for your availability
you.
today. Thank you for your
Yes.
availability. We would have wished that you have at least one more day with us. But then, thank you for your availability. It was
Yes,
very
thank you.
very well presented. Over to Rabia Begum for proposing the word of thanks. Rabia, you can come on the video, please. Yeah, okay.
Sir, am I audible and visible?
Yes, you are very audible and very visible.
Okay, sir. Gratitude is not only the greatest of virtues, but the parent of all others, by Sir Cyril. Good evening, everyone. With immense gratitude and deep appreciation, we extend our heartfelt thanks to our esteemed resource person, Dr. Iniga Maria Divya B, for guiding us through this insightful and transformative session on awareness of mental health and stress management during the 4th week of our program. Your wisdom, eloquence, and engaging approach have provided us with profound insights and invaluable techniques that will strengthen our ability to support and guide others. The knowledge you have shared on understanding mental health, recognizing stressors, and implementing effective stress management strategies has left a lasting imprint on our minds and hearts, ma'am. This session was not just informative, but also deeply inspiring, thought-provoking, and interactive. Topics such as major mental illnesses like depression, anxiety disorders, obsessive compulsive disorder, substance abuses, and the coping mechanisms were discussed in depth and helping us gain a clearer understanding of these critical mental health concerns. We are sincerely grateful for the time, effort, and dedication you have invested in enlightening us, ma'am. Your passion for empowering others with knowledge is truly admirable, and we feel privileged to have had the opportunity to learn from you, ma'am. A special note of appreciation also goes to the Department of Counseling Psychology at St. Joseph's College, the head of the department, Dr. A. John Balaya, the faculty members, and the technical team for their unwavering commitment to making this certificate course a success. The dedication, meticulous planning, and seamless coordination have ensured a smooth and enriching learning experience for all of us. We also extend our gratitude to the participants for the enthusiasm and extend an active engagement, which made this session even more meaningful. Once again, we extend our deepest gratitude for invaluable contribution, ma'am. We look forward to many more such enlightening and inspiring sessions in the future. Thank you all.
Yes, thank you, Rabia. It was very well presented. And thank you, doctor. Yeah, we hope to have you for an offline session. Maybe when you come to Trichy, yeah.
Sure.
So we will have an offline session.
It'll be better if it's it's an offline session. It's the first time I'm presenting it online, sir.
Oh,
Almost
okay, okay.
been presented in 20, 30 times, but not offline. This is the first time I'm doing it offline.
I think your bandwidth is little low. Your network, the
Yes,
bandwidth is,
sir.
yes, yeah. Therefore, there was some incompatibility
Yes.
with your audio and video. But
Okay.
that was only in the first part. But
Yes.
the second part, it was, there was compatibility. Very well
Yes.
done. Yeah, very well done. Yes. So thank you very much. So that's all for today. And we call it good night to all of you.
Yes. Good night, sir. Thank you, sir.